AI is being integrated into more parts of the U.S. healthcare system. In Utah, for instance, AI technology is now able to renew prescriptions without a human being ever being in the loop, aside from you, the patient. Joining us right now is Dr. Adam Oskowitz and Matt Pavel. They're the co-founders of Doctronic. That's the AI health tech startup behind Utah's program. And gentlemen, welcome. It's great to see both of you.
Thank you so much.
Thanks for having us.
There are so many things that people talk about with AI and medicine and how that's going to potentially speed drug discovery. But what you guys are working on is something that makes sense, and it seems like it's been some low-hanging fruit. Doctors spend a lot of their time doing paperwork and not necessarily doctoring. Why don't you talk about how Doctronic works, how you guys came up with the idea?
Sure. So Doctronic is an AI doctor, and we've seen 20 million patient consultations so far, but we have a primary care practice behind it. So you can always talk to the AI doctor for free, and then you can see our primary care doctors if you want. And those doctors are available 24/7, licensed to practice in all 50 states, and we see thousands of patients a week with our human doctors, too.
It can prescribe anything to me, or I think you have a list of certain medications, the ones that are pretty easy to do.
Yeah, so the program in Utah is a little bit different, right? That is an AI system without a human in the loop. And we have a formulary that we've come up with the state of Utah, consists of about 200 drugs, most of them low risk.
Most of them low risk, meaning you're not going to give somebody antidepressants necessarily or any narcotics?
So, yeah, no scheduled medications, nothing that could be addictive. We do prescribe antidepressants. Those are medications that we would consider low risk. And a lot of people are on those for chronic conditions.
What is the speed issue? What's the problem issue? Where's the bottleneck, shall we say, in terms of people just going to the regular primary physician?
Yeah, so it takes about 26 days for somebody to see their primary care physician today. That causes a lot of bottlenecks. The U.S. government pays about $100 billion because of medication noncompliance every year. Improving access can actually solve that pretty quickly.
How often do I have to see a doctor right now? Because it strikes me that when I have a prescription that's up, I just call my doctor's office and they renew the prescription for me. It's probably only an annual visit that I have to make to the actual doctor themselves.
Yeah, I think that's about right. There's going to be visits in between where you do need to renew your medications, and it's going to take a long time to do that. And so by filling in those gaps, we can allow doctors to practice what they really want to do at the top of their license.
But when I call my physician's office, I don't talk to the physician usually for a refill. I just talk to the assistant in the front of the office.
Yeah, it depends on the doctor that you're talking to in the office that you're talking to and the medication. I have high cholesterol, so I'm on a statin. Every 3 months, I have to have a conversation with my doctor because that's what she wants, and that's fine, but it's cumbersome.
And part of the problem is that people in rural areas in particular don't have access to physicians as easily?
Yeah, that's correct. And, you know, I think most people out there have realized that it's actually hard to get in front of a physician. Right? A lot of people actually don't have primary care doctors, and so they go to the emergency room for these refills.
Right. Is there a situation where the AI doctor would tell me, no, you can't have that prescription, or is this an automatic yes every time I call?
No, that obviously wouldn't be AI at that point. That would just be a rubber stamp.
Yeah.
So the AI does go through a process of making a clinical decision, right? It gathers a bunch of information and decides, yes, this is safe for a refill, or if it decides it's not safe for a refill, it escalates you to a human doctor so that you can talk to them and actually get that medication if needed.
An important aspect about this whole process in Utah, too, is we're only charging $4 for the AI to do that whole renewal process, and that will be reduced at scale. So it's really helpful for people who don't have health insurance or have health insurance with high copays. The cost of seeing a doctor is also a barrier to getting a refill.
Yeah.
Especially when you then have to pay for the prescription.
So what about these mistakes that we see in AI from time to time? How do you guarantee those mistakes either don't happen or happen at a very minimal amount when you're dealing with someone's health?
Yeah, I think it's important to realize that the product you're using when you are in the state of Utah is fundamentally different from what you would use if you went to a ChatGPT or Anthropic.
That's what I'm going to say.
There are guardrails within our product that are not powered by AI. So the AI is sort of the engine. We built a car around it so that it's safe and effective. And so there are about a dozen checks that happen on the back end when you come and see our system so that we can't prescribe things that are not appropriate.
Our team...
Is it a small language model, not a large language model?
It's multiple large language models strewn together with a number of models that we've built ourselves.
And I'm sorry, you were going to say what?
I was just going to say our doctors are overseeing some of this and making sure that things are working. And they say that the AI is asking more questions than they could possibly ask during a refill process. It would take them half an hour to do this, but the AI is doing all of these things by itself.
Can I ask just one question about the refill process itself?
Yeah.
I have a doctor who, like your doctor, who wants you to call every 3 months or see you every 3 months.
Yes.
And it seems insane. And it seems like I don't know if they're doing it for actual medical reasons or they're doing it to try to get me into the office so they can charge me by the... No. I want to actually just speak to the actual thing, because there are doctors who I think are using this process not just for medical purposes, but possibly to rip people off.
Yeah, I mean, there is certainly a component that some physicians will use it to come and see them, right? They generate revenue when you see them. That's for sure. The vast majority, though, are actually checking in with you, just making sure everything's okay, because they don't know if you're actually taking your medication. They don't know if the medication is working. And so it's really just a check. Right. And that's why AI is so important here, because that's something it can do quite
so
safely.
Interesting, like statins, for example. Yeah. There's no question that when you first start on a statin, you do want to come back to make sure that it's actually working and your cholesterol is going down and all of those things. But after you have figured out that it actually works, the idea that they're not prescribing you, a year's worth or 2 years worth of this stuff makes a lot less sense.
That's right. I have to have an annual blood test, because I'm on a statin. Great. The AI will know that and say, okay, you've had enough refills. Now you need to get your blood test before we'll give you another renewal.
Most of mine will just give it to me when I call
a year,
them
for sure.
Yeah, for a year at a time.
I think
some do, but I'm just saying there is a use. I've seen it where there are certain doctors who just will not help you. Yeah. By the way, I had an eye doctor. I needed to get new glasses, oddly enough, and I hadn't seen the eye doctor for a year. They said, the prescription is no longer...
Every year. That's every eye doctor. They won't give you contacts for more than a year.
I'm thinking, this is insane.
The other big scam around here, if you don't want to go every 6 months or 3 months, you can have the concierge service. And that's like 15 grand a year.
You can afford that.
But apparently the office will take your calls.
Day and night.
No, like business hours. Right.
Well, interestingly, we're day and night.
Let me ask you, how do you guys make money? If it's only $4 for every visit that comes through,
so we actually have a margin on that because it's mostly AI, right? Yeah. We're not paying for the medication itself, but the AI running and everything that goes in.
I just thought it was expensive to develop large language models and stuff that goes on top of them.
It's expensive to develop, but it's not expensive to run, and that's the secret. Right.
So what's your break-even level? How much do you have to make to be like, okay, this is profitable at this point?
I mean, our margins on 4 are enough. And frankly, a lot of that is some of the things like the identity verification that we have to do, which is only that first time. Once you're a customer, we don't do that again. So we should be able to drop those prices in the future after you've already started using the system.